This is my video on changing a condom catheter, and I'm going to get started here and showing you how to measure urine, and I'll also show you on a female client. My name is Lori. Make sure you introduce yourself to the client. Make sure you do the knock, knock, knock. Make sure you read the care plan. See if there's any restrictions or anything else on that care plan that may apply to your client. Make sure that you do the knock, knock. Identify yourself and address the client as whoever he is, with Mr. and Mrs. Hello, Mr. Jones. How are you today? I'm your healthcare aide, Lori. Can I see your ID? And you verify that with the client that it is Mr. Jones. You tell him what procedure that you're going to do. You're going to give him, change his pouch and condom catheter. Ask his permission. Make sure that it's in your scope of practice. Make sure that it's within the standards, and you follow the standards and the facilities in which you work. Once you've introduced yourself and everything's good with the client, check the bed. Make sure the brakes are on the bed. Make sure the rails are up. Gather your supplies. You have your basin to put the urine pouch in. You have your basin of water. Make sure you measure the temperature with the thermometer. Test the water yourself. Have the client test the water, that it's okay with him also. I have a kidney pan or a bowl to put the pouch in. I have the water. I have the washcloths. I have the towels. I have the bath sheet. I have a waterproof pad. I have the Perry soap. I have hand sanitization. I have alcohol swabs to clean the tubing in case I touch anything, or the tubing itself touches anything. I also brought a clamp, which I'll show you what you use with it later. Paper towels. Make sure you clean and sanitize your hands before you enter the room. And put on gloves. Give your client privacy. Make sure that you raise the bed up to the proper body mechanics. Make sure the bed rails are raised up properly to your body mechanics. Make sure that the client is, it's okay with the client. Make sure that there isn't any unusual. Ask the client how he is, if he's in pain. Talk to the client. Clean and sanitize your table before you put your supplies on. Either place a towel underneath and a piece of paper towel under your supplies. Make sure you have your two garbage, your bio-waste containers and your disposable waste containers. And make sure you have a cylinder in case instead of removing the bag completely and taking it to the washroom, that you can actually drain the bag by the bed and collect the urine to check the urine sample for various things. Discoloration, you follow your COCO plan, which is color, odor, consistency, and amount, which is kind of a good code to follow at all times. So we got our clients in the right position. We have the bed raised up. We lower the bed rail on our side. We get the client to help us if he's capable of helping you. Otherwise, you position the client properly and turn him or have him raise his hips to place your waterproof pad underneath. And we're just going to lift this guy up here and place this underneath. And don't ever leave your client. If you leave your client, raise the rails of the bed. So right now I'm just going to raise the rails of the bed and return to my client's side. Make sure the brakes are on the bed. Make sure you have your new condom catheter system. Make sure it's the right system. Make sure it's the right procedure in which you change him. Make sure that it's the right client. Make sure that everything else is what it should be. The right client, the right condom, the right system, and you're good to go. So the client's laying on the bed. Hello, Mr. Jones, you're doing just fine. I'm going to drape you with a bath sheet here, and then we will get started if that's okay with you. Yes? So you fan fold the linens up to the top, or the bath sheet, sorry. Fan fold the linen underneath to the foot of the bed. And only expose the area in which you need to work on. Make sure the client has privacy. Give him that dignity. I want to make sure you can see this. So we're going to fan fold the bath sheet back. Now this should have been attached to this, but it isn't. The condom is attached to the penis with a tape. It would be paper or elastic. Another type of tape would restrict and cause a lot of problems. So I'm just going to pretend that it was attached here because I don't want to wreck my condom. The tape is put on a spiral fashion, so you remove the tape. Wouldn't probably come off so hard. You would dispose of the tape in the waste basket. You would roll the condom up, remove it from its tubing, tap the tubing. If this was touched to any other surface, you would wipe it with alcohol swabs, which I will do later. You dispose of your condom. This is capped. If this was, make sure that this is closed. If it was just changing or draining the urine, you would make sure, or just changing the bag possibly, you would just make sure this drainage was closed. So we're just going to put this here, make sure this doesn't touch anything. We're going to change our gloves. We're going to practice hand sanitization. And if I forgot to mention gloves and the peri-wash and the hand sanitizer, well, I do have it. So I'm going to sanitize my hands. I'm going to put on a fresh pair of gloves. I'm going to check my equipment. I'm going to make sure that my gloves are intact. I'm going to get the client to check the temperature of the water. Make sure it's good with the client. I'm going to fold my washcloth properly into 3, fold it back. I'm going to use the peri-wash. Sorry, I gotta switch hands. There we go. If the penis is circumcised, you roll the circumcised gently back, roll it slightly gently backward, and you clean a circular motion. You're only doing the peri-care. You clean the meatus, rinse it, peri-wash, clean down the shaft, turn your washcloth around. There you go. Rinse, peri-wash, clean the scrotum. Rinse, peri-wash, clean the manus pubic, turn your washcloth down one side of the groin, other side of the groin. rinse, pat dry, roll the foreskin back up, turn your towel around, dry the area thoroughly, air dry the area, check the skin for any abrasions, discoloration, any other any secretions coming from the penis, or pain or anything like that, in which the client might tell you. If everything looks good, if it doesn't, report to the nurse or the HR. Change your gloves. Dispose your gloves properly in the proper disposal. We're just going to put these back here and use them. And sanitize your hands. Check your equipment. So you peri-washed the client, and it makes them feel refreshed. Now, if we had to change the whole pouch system, we would put this in a pan, and you could possibly cover it if you want, and make sure that it's capped, because you will take the pouch into the washroom and you'll be able to measure and observe the urine content in the washroom. So we're just going to pretend that we have an extra one there, and we're going to put our new system on. So this would be a brand new one, and then I'll show you how you practice draining the bag, or you could drain it while the client is on the bed. So we have, if I haven't lost it, I probably have. Oh, here it is. You would make sure you got the right size, make sure you have the right pouch system. This would be rolled up. There might be an adhesive on the end in which you may have to peel off. So we just hold the penis in an upright position, and this would just gently roll down on the penis. Make sure that you leave an inch from the top on the condom, and this is not rolling down very good, but it does roll, and you leave an inch from the top. Once it's all nice and straight and there's no wrinkles, I forgot my tape. It's going to get that. You make sure if you left the client that you would roll out the bed rails. You wrap this tape in a spiral fashion to secure it to the penis. Make sure there's no wrinkles, and it would just be in a spiral fashion. You attach the condom to the tubing. This would be thrown away. You would have fresh caps. Now, to clean this tubing, you take an alcohol swab and clean about an inch in the tubing or in the drain if this touched anything, and you would throw this in the proper disposable waste. Make sure this is secure. Make sure that the bag is attached to the bed frame, and it's below the bladder. This bag is never above the bladder, it's below the bladder. And do the usual procedure. If you were just going to change this and have the client there, you would remove the blue pad and fan fold the linens back up. You would put the bed rails up, lower the bed, and position the client, leave him his caldwell, and have him back in his proper position he'd like to be in. Gather up your supplies and change your gloves, and take the urine sample into the washroom. But here, if this bag was off, This is our, we'll just pretend there's a bag on there. This is the bag that we have emptied. And we would take this into the washroom, put on new gloves, clean and sanitize your hands. If we were draining the system, we would open this. This actually has a measurement on it that you can actually see it, but that's not how you measure the urine. You would place the cylinder under the drain, open up the drain, do not touch this drain to any part of the cylinder, and drain the contents of the pouch into your cylinder. You would clean the tip of this with the alcohol swab, or if it touched anything, and you would put it back in position, make sure it was closed. When you collect the urine sample, you look for color, consistency, odor. Healthy urine should be pale yellow, possibly a few particles, and the amount. And you would set this on a level surface at eye level, place a paper towel under it, and report the urine, or as per care plan instructions. You would then empty this, or if you had to send the urine away or collect the urine or whatever you had to do with it, you would empty the urine. This is one we're going to empty. We're going to rinse it with cold water. We're going to flush the toilet, then we're going to rinse it. We're going to disinfect the cylinder. We're going to dry the cylinder. We're going to get rid of our paper towel. We're going to place the cylinder once it's dry in its proper position in the washroom. You look for color, you look for odors, you look for consistency in the urine, and amount. The normal amount an adult has of urine in a day is about 1,500 milliliters. And the bag also has some amount. So we're going to put this back on this client here. And then you come back and you clean up your supplies, disinfect your hands, and do all the happy stuff. So if this was a female, and it was an indwelling catheter, which is inserted into the urethra of a man or a woman, which allows the urine to drain into the pouch, and you were cleaning this type of catheter, which would be indwelling one, you would give the pericare, examine the area, the skin, and everything else for any secretions or fluids or crystals or anything. You would wear gloves. You make sure you have gloves on. And this was a female, and it was an indwelling catheter. You would hold the tubing while you were doing the pericare, clean 10 centimeters down the tubing with water, warm water, and do your pericare. Hold the tubing so you don't dislodge it while you're cleaning, and you could drain the bag on the floor. So if you drain the pouch, you would put the cylinder on the floor with the paper towel underneath and open up the drain, clean the drain with an alcohol swab, and collect your urine that way. This would then therefore air dry the same area as a male and do the same procedure, except you would be holding that tubing. It was indwelling. There's a suprapubic catheter, which is an incision in the abdomen where the urine drains through that also. So you put on the catheter on your male client. You handfold the linens, clean up all your supplies. Make sure you change your gloves. You disposed of the lint of your urine. You cleaned up your supplies. Record a report. Ask the client if he needs anything else. Put him in. Put his call bell by him. And make sure that you record any findings to the HR or the nurse. Record a report, and wish your client to have a great day. Thank you. That's it.